Diabetes can affect your life in many ways, but did you know it can significantly impact your sexual health? You might think that managing blood sugar levels is the only concern, but the reality is that diabetes can affect relationships, self-esteem, and intimacy. Let's explore how this condition touches every part of life and what can be done to maintain a fulfilling sexual life despite the challenges. The hidden challenges of diabetes. Imagine feeling disconnected from your partner because of health issues you can't fully control. That's a common experience for many people with diabetes. This condition isn't just about sugar levels, it influences hormones, nerve function, and even mental health. Let's break it down into two parts: how diabetes impacts men and women differently. Diabetes and women's sexual health. For women, diabetes can lead to nerve damage, affecting sexual arousal and pleasure. You may find it hard to feel stimulated, or you might not experience enough natural lubrication, leading to discomfort during sex. This can create a cycle where intimacy feels more like a chore than a joy. Moreover, during menopause, blood sugar levels can fluctuate wildly. Imagine trying to enjoy intimacy while worrying about a sudden drop in sugar levels. You may have to pause to check your glucose, which can interrupt the moment and add to the stress. Women with diabetes are also more prone to infections like thrush and urinary tract infections, which can further complicate sexual experiences. The body can feel like it's constantly battling, leaving little room for intimacy. The struggles for men with diabetes. For men, diabetes presents its own set of challenges. One of the most common issues is erectile dysfunction, ED. The body needs proper blood flow to achieve an erection, and diabetes can damage blood vessels, making this difficult. You might find yourself feeling frustrated and embarrassed, leading to decreased self-esteem. Reduced testosterone levels can also dampen your sex drive. Men with diabetes often feel tired and overwhelmed by managing their health, which can lead to a diminished interest in sexual activities. The psychological toll. Both men and women with diabetes often face psychological challenges that can affect their sexual health. Anxiety about health, changes in self-image, and fears about sexual performance can create a heavy emotional burden. Feeling isolated or depressed can make even the thought of intimacy seem daunting. Imagine trying to be intimate when all you can think about is how you feel about yourself. This emotional barrier can lead to further disconnect in relationships, leaving both partners feeling frustrated and unfulfilled. Open communication is key. It's crucial to talk about these issues with your partner. Imagine having an open conversation where both of you feel heard and understood. Early discussions about diabetes and its effects can foster understanding and reduce embarrassment. Explaining your situation to a new partner can pave the way for deeper connections. Share your feelings, fears, and any practical needs, such as checking blood sugar before intimacy. Managing the impact of diabetes on sexual health. Regular checkups. First and foremost, keeping your diabetes under control is vital. Regular checkups can help you manage blood sugar levels and catch potential complications early. Consult your healthcare provider about your sexual health concerns, as they can provide personalized advice. Medication management. Some medications can help. For men, options like Viagra and Cialis can improve blood flow and enhance erectile function. Women may benefit from vaginal lubricants to ease discomfort during sex. But remember, always consult your doctor before starting any new treatment. Psychological support. Consider seeking support from a counselor or therapist. Talking about your feelings can be a huge relief and can help you regain your self-esteem. Couples counseling can also provide tools to improve intimacy and communication. Lifestyle choices matter. You can take charge of your health through lifestyle changes that improve both your diabetes and sexual health. Eat healthily. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help maintain stable blood sugar levels. Imagine nourishing your body and soul through food that fuels your energy and mood. Stay active. Regular exercise can boost your energy levels and improve self-esteem. Aim for at least 30 minutes of activity most days. Think of it as a way to reconnect with your body, enhancing both your physical and emotional well-being. Practice stress reduction. Engaging in stress-relieving activities like yoga, meditation, or hobbies can improve your mood and help you feel more connected to your partner. Picture the relief of letting go of stress and focusing on the positive aspects of your life. Explore new intimacy strategies. Both men and women can benefit from pelvic floor exercises, known as Kegel exercises. For women, these can enhance sexual response and pleasure, while for men, they can improve control and reduce the likelihood of incontinence. To practice Kegels, identify your pelvic floor muscles by stopping the flow of urine. Once you identify them, tighten and hold for a few seconds, then release. Start with 10 repetitions twice a day, gradually increasing the hold time. Addressing the myths and misunderstandings. There's a misconception that sexual health problems are inevitable with diabetes. While many face challenges, many individuals with diabetes continue to enjoy active, fulfilling sex lives. Studies have shown that a significant number of men and women with diabetes engage in sexual activity regularly. If you have concerns about your sexual health, don't hesitate to reach out to your healthcare provider. Ask questions about managing your diabetes, other health issues that could impact your sex life, and any medications that might be affecting your libido. Conclusion: embracing open conversations. Navigating sexual health with diabetes can be challenging, but you are not alone. Reach out for support, whether from your partner, friends, or healthcare professionals. Remember, open conversations about diabetes and intimacy can foster understanding and deepen connections. You deserve a fulfilling sex life, and addressing these concerns head-on can pave the way for a healthier relationship with yourself and your partner. Don't let diabetes define your experience. Take proactive steps to reclaim your sexual health and happiness. By understanding the complexities of diabetes and its impact on sexual health, you can navigate these challenges with confidence. Embrace open communication, seek support, and explore lifestyle changes to enhance your overall well-being. Remember, you are in control of your health and happiness.